Well, the outside is the renal capsule. Though I don't really see it here as any number. Okay. So the cortex, although this is labeled as B right here, the cortex is actually all this right here. Okay? All this here. Not just this right here. It's all this. Okay? The medulla is everything, or A. So here they call it the marrow of the kidney. It's the medulla. Okay? And the medulla is all this here. Okay? Number 7 is the pyramid. Okay, so these are the renal pyramids, or the medullary pyramids, whichever one you want to call them. And then these things right here, these are the renal columns. Okay? Alright. And then, do they say what the papilla is? I don't have it labeled. Alright. So, although it's not labeled, this here is the papilla. Okay? And as you can see here, that this is the papillary duct. Okay? Which empties out the papilla. Alright? And this is emptying out into the minor calyx, which then empties out into the major calyx, which is right here. Okay? And then all that empties out into the renal pelvis, which is number 4. Okay, so 5 they call the calyx. Right? So here we have, so since here you have one pyramid emptying out, it's emptying out to the minor calyx. Now here it just calls it the calyx, so you have a free pass there. Okay, empties out into the renal pelvis, which then empties out into the ureter. Okay. Alright. Papillae. They do have the papillae, which is number 6. Okay, so you see here, number 6. This is referring to a pyramid that's in there. Okay, but what's really showing you is this area right here. So this right here, number 6, is this, okay? You understand? But it's just at a different angle of the kidney. Alright, so let's talk about the blood supply for a minute. So this is your renal artery. And try to study these when you're studying them as blood is going through the kidney. That way it's easier to learn, okay? So this is the renal artery, okay, which will then become the interlobar artery, which will then become the articulate artery. Actually, you don't have the segmental artery, which is interesting here. Just make sure. No, there's no segmental. All right, anyway. Okay, so here you have your articulate artery, which they call 46. Is that 46? 16. Okay? And then these right here, these are the interlobular. Please don't get confused between interlobar and interlobular because they sound very similar. So interlobular are right here. Okay? And then from the interlobular, you have, they have the afferent is 14. So the afferent are these right here. Okay, so this again is the interlobular. Okay? And then the little red part right here is the afferent arterial. Okay, now the efferent is over here, so let's stay with here. All right, and then the whole entire nephron is this whole thing. Okay, this whole thing is one nephron. All right, so then this little ball right here, they call 12. Well, that could be the glomerulus or the capsule. Okay, so they call this the corpuscle. So what's the renal corpuscle? What does it consist of? You told me. The capsule and the glomerulus. Very good. Okay. All right. So what else did I mention? Everything here. 16A. They're just saying that this is the capillary network. So imagine that this is what's encircling all of these structures. Number 8 right here is the collecting duct. Okay, so you can see the collecting duct collects from many different nephrons. See, here's another one that it's collecting from. And then from the collecting duct, it's going to go down into the papillary duct. Okay, so if we go in order, you have the renal corpuscle, which is composed of the Bowman's capsule and the glomerulus, and it will empty out into the proximal convoluted tubule, down the descending loop of Henle to the ascending loop of Henle, to the distal convoluted tubules, down the collecting duct, down the papillary duct, into the papilla, which will then drain out into the calyx. Okay, from the calyx, it will then empty out into the renal pelvis, which will then empty out into the ureter. Okay, so let me just make sure I said everything from this. Okay, so that covers the kidney. Now let's go into here, the nephron. Okay, so now we're zooming. Okay, this is a zoom of, let's say, this area right here. Okay, so again, this out here is the renal capsule. Very good. Renal capsule, not corpuscle. And then this is the cortex, and this is the renal pyramids or the medulla. Okay, so here we can see both types of nephron. So this would be the cortical nephron, okay, and this would be the juxtamandibular nephron, okay, which just has a longer loop of Henle. Okay, and so remember that the capillary bed that covers the cortical is the peritubular, which is number 11. Well, I think number 11 they just call capillary network, so you're safe there. Okay, and then the juxtamandibular has also the vista recta. I believe they don't have labeled here. All right, so let's go through number 1. So number 1 again is the corpuscle. So that's both the Bowman's capsule and the glomerulus. Here, this is the afferent arteriole, which is number 9. Okay, afferent arteriole. This is the efferent right here, which they label 10. Efferent. Okay, and then we have inside here is the glomerulus, Bowman's capsule, and this would be the proximal convoluted tubule, which is 2A, which they don't call it proximal convoluted tubule here, okay? They call it the pars convoluta. It's the proximal convoluted tubule. Once I get a printout of these, I will write out next to it, okay? And then you have the descending loop of Henle, B, ascending loop of Henle, C, and then here you have the distal convoluted tubules, which they call here the connecting section. Yeah, here they also call these like the tubules too, but that's not what it is. All right. And then that will empty out into the collecting duct, number 6. Okay, as you can see, there's many collecting ducts for the rest of the nephrons. And then this is the papillary duct, which empties out into the papilla. All right, and then what? Oh shoot, I didn't. Sorry, let's go back here for a second. This is the renal vein. Okay, and they do mention all the veins. Okay, so let's go back here for a minute. I'm sorry, the renal vein, and then we have the interlobar vein. Okay, which then becomes the articulate vein, which will then become the interlobular vein. Okay? All right, so coming back here. So here we have the interlobular vein right here. All right, which will become the articulate vein. All right, this is the articulate artery. All right. I think I mentioned everything here already. This is the interlobular artery. Right, have I mentioned that? Okay, so we're done with this one. Now let's go over here. Okay, so now this is showing you the corpuscle, the renal corpuscle. Okay, so here, this right here is the distal convoluted tubule, which makes up part of the juxtamandibular apparatus. Okay, remember this is where I told you that the cells, the juxtamandibular cells, are the ones that are going to act as biosensors. Okay, so here we have, so see, they label as so this is the afferent arteriole. Okay, so the blood is going to come through here, and it's going to enter through the glomerulus. So the glomerulus, which is this right here, what do they call it? Vestibular loops. Okay, so first you have the membrane, okay, of the glomerulus, and then on top of the glomerulus you have the podocytes. Okay, so these are cells. And the cells plus the glomerulus will make up what's called the filtration membrane. They don't even label it here. Right, so 9 they're called epicytes. That's not what they're called. They're called podocytes. All right. And then this right here, or number 10, is the Bowman's capsule. Okay. Number 5 is what they call